So you've gotten a sense today of the personalities. Libby, I loved that. I don't know where she went. I can't see because of the light. But the humor in the last. We take our work incredibly seriously, but ourselves not quite so much. And we know that there's a great deal of angst about what the future looks like, because after February 7, the ARRA funding that California has been blessed with is gone. But the work continues. And we take that responsibility to help you continue to advance HIE very seriously. I still won't take myself very seriously, but I take that work and that challenge extremely seriously. And people say to me frequently, what are we, the collective we in California, going to do after February? And I know that you, who may be just starting this journey or just starting to understand your place in this HIO landscape, may be asking yourself the same question. What am I going to do when the seed grants are gone, and I missed the opportunity for those, and the people, the convenings where we can come together every few months and meet new people and talk about what we've learned, when those don't happen anymore, and what are we going to do to make this continue to ripple and grow more robust in California? So we put together this particular group at the end of the day to talk about what will continue to exist, perhaps more robustly than has been the case, and what the future for resources for you looks like. Because we have always been thinking about the end. And this is not the end, this is the end of the beginning. We're just coming to the end of the beginning. And so, who are you going to call? And what are the efforts that are going to be in place? I know I wanted to play that Ghostbusters music when I said that. Because you know that, what are you going to do when the challenges are right smack in front of you? And so I'm going to start off with Alicia Adamson, and she's going to share with us an incredibly exciting initiative that California has been supporting that is really a national initiative, so that well, I'll let her explain it. And she'll tell you about our friend, Ollie.
Thank you very much. I'm going to ask for your forgiveness in advance if I sound winded. I have this little person pushing my lungs into my shoulders. So, my name is Alicia Adamson, and I am the project director for Ollie. Oh, I get to push a button. I saw that in the last presentation. So Ollie is the Open Library of Health Information Exchange. We've been funded by the Office of the National Coordinator to develop what I like to call a public good. This is a national asset. This is something that we're doing for all of us. The Open Library is endeavored to accelerate the rate of and decrease the cost of connecting to health information exchange by facilitating the reuse of assets that all y'all have been developing. And Ollie started off as the Interface Library Project. And we had some funding. Myself and Dr. Rob Kolodner traveled around the United States meeting with stakeholders and asking, would an interface library be interesting to you? And people said, well, yeah, that would be pretty groovy, but I think we'd like to have more than just interfaces. I mean, we're developing policies and toolkits and use cases and white papers, and I got this great little widget that I just wrote. Can we share that also? And so we asked the ONC, can we share that also? And the phase 1 report was well accepted, and we were funded to build the library. So the library is going to include all of those things, and a little bit more. I'll talk about that in a sec. So the library works off of a library paradigm. The atomic unit, fancy phrase, huh? It's fun to say, the atomic unit for an asset is a book. If you upload a policy, you upload an interface, it is uploaded, it becomes a book. If you upload an asset, you are an author. If you come to visit us at the library, you are our patron. If you download assets, you're a patron. You have your own bookshelf when you become a member, and you can put books on your bookshelf. You can create collections. We want to include some modern social networking and collaborative tooling so that you can say, you know what, this is a really good book. I really enjoyed reading it. And then your colleagues can go, oh, hey, look, Sarah really liked that book. I probably would like that book too. Maybe I should look into it. OLLI includes some sophisticated search mechanisms in place. So let's say that RIM has written this whiz-bang policy about consent vehicles for minors, and you're very interested. So how do minors consent for their own HIV? Thanks, RIM. And so you look this up, and it's really a great policy. You love it. Your friends love it. Everyone's given it 5 stars, 4 stars, some good comments, and they push that little meet the author button. We want to be able to facilitate collaborative exchange of information. So I can call up RIM and say, hey, 200 people want to talk to you about this policy that you wrote.
201.
201. And be able to open up a classroom and let y'all talk to each other about what y'all are doing. Taking that library paradigm, to the next level. The libraries that we used to go to, where you'd have a bulletin board and people say, hey, I'm working on this project. Would you like to help me with this? Are you interested in this? Let's create ad hoc committees. A lot of that collaborative tooling actually came directly from California. They were really interested in finding ways to make sure that you all had a chance to keep working together. So OLLI is endeavoring to do that. We already have a good bit of that information in place. Now, one of the things we don't want OLLI to become is a dumping ground for all y'all's stuff. Certainly we want all of those assets to be there, and it wouldn't be that hard to create a repository of stuff. But what's going to be interesting is when we can identify the value in that stuff, things that other people are interested in. And so part of that valuation comes from you saying, hey, I really enjoyed reading these books. These are good. Creating affinity domains. If you liked this book, you'll love this book, kind of thing. But we are also working with, there's a company called Aegis that is known for testing and vetting software. So for the code assets that are in OLLI, before you download it and sick your IT guys on it to explore it, you want to have a sense that it's actually going to do what it says it's going to do. So we'd like to partner with this company to help us identify these assets that do what they say they're going to do, give them a gold star or a little gold worm, that says this is a good piece of software. And we are hopeful that you will find value in that kind of service. We're not there yet, though. So, there's my next bullet point. So where we're at right now with OLLI, we've been, if you go to our website, you go to olli.org, olhie.org, and you can go see our bubble chart. Bubble chart's like a progress report chart. I like bubbles better than bars, so we have bubble chart. And you can see how quickly we had to work to develop this stuff. We're under that same time constraint that y'all are under. And we've developed a proof of concept that launched in July. Our Architecture and Technology Committee was very excited. Our early stakeholders were really excited about this new paradigm, this new way of engaging information. And we got the go-ahead to do the 1.0. The 1.0 is expected to launch December 20th. That's coming up. It's just around the corner. And we'll be working with Cal Ojai and with Czech, and some of you actually are already in the queue to start uploading assets. We have a lot of other community members, as Pam said, from across the country. So if you're interested in knowing who they are, go to our website, click on the committees link. You'll see some familiar names and folks from all over the region. We are in the middle of what I call building the business around OLLI. We've got the software. We feel pretty good about it. We've got the community. We've got a lot of people that are interested and involved in this work. But now we've got to figure out where sustainability is going to come from, what the membership models are going to look like, and that type of work. So I think it's pretty awesome. I've really enjoyed this and really enjoyed our community. So let's see. Are you going to call? You're not going to call me because I'm going on maternity leave. But I encourage you to call Jenny Yost or Bruce Amato, who's going to step in for me while I step out for a little bit. They're really great people. They're fun to talk to. And so if you have any questions about participating, if you want to contribute in ways other than assets, you want to sit on a committee, you want to draw some worms for us, anything really, just let us know. We're really interested in making sure OLLI does something beneficial for you. I look forward to your questions.
Thank you. So next is the person who's going to write that policy that everybody's going to want to be in the classroom with, and that's Rem. Rem's up, and he's going to talk about check. Stuff. No, stuff, check, and he's going to talk about K-High, actually. He can talk about anything you want to.
I'm not going to talk about that cool policy that I've written. So I'm gonna be wearing two hats here. So yes, I'm going to start off by talking about check, and I'll be honest with you, I'm not really big on mission statements and vision statements and some of the things that go along with them. But I thought it was important to actually go ahead and put it up, because I think one of the things that we have a tendency to do is we talk about HIE as if it is what our goal is. And obviously our goal is an HIE. HIE is a tool to help us get to our goal, and our goals here have been coordinated and integrated care delivery. And HIE is merely one of the tools that we see getting there. Over the past year, CHEC has been primarily concentrating on moving HIE forward to meet these goals. And I think that what we're seeing ourselves as focusing on as we move forward is moving from health information exchange to really thinking more about interoperability, not just moving data around, but also understanding the data when it arrives at its destination. So expect to see us move more towards interoperability than just health information exchange. Our big objectives over the course of this year are things that we have worked on but are going to be continuing to work on in the future. The big thing has really been using HIE to help improve healthcare outcomes through coordinated care. And that's something that I think that everybody believes in, but it means that we've been focusing on dealing with care coordination. One of the big issues, the big targets for us was to make sure that we put good use to the ARRA funding that we've been responsible for. I'm not going to harp on that very much because you heard a lot about some of the progress that's been made through the state. But I do think that what's important is, in addition to the expansion grants, the infrastructure grants, the interface grants, the immunization interface grants, and the rural program grants that we've been putting out, that helps everybody in the room, not just the grantees of those. As we move health information exchange forward, we're beginning to reach critical mass in actually getting things accomplished, and I think that's a good thing for all of us. I have to admit, I enjoyed going by the graphic on the wall over here and seeing that CHEC is identified as the car carrier. And I think that that's kind of how we see ourselves. We're not HIE, but we're trying to move HIE forward. Now, obviously, with the end of ARRA funding, that won't be one of our strategic objectives anymore. And I know that a lot of people have been asking, so what's going on with CHEC after ARRA funding? Well, IPHI sees health information exchange as continuing to be an important part of population health. And so CHEC is going to continue as we move forward, and it will be diminished as a result of the decrease in funding, but we're still going to be around. And so what are we going to be around doing? Well, we've spent a great deal of time and effort in putting together a trusted environment for exchange, and that's still going to be one of the things that we're going to concentrate on in the future, working with K-High. So that's not strictly a passing of the baton, but something that we'll be working on jointly. And we're going to be focusing even more on trying to integrate HIE with other things. You know, there are other activities, ARRA activities have been going on in the state, and our expectation is that we're going to be working a lot more together in the future. I think that what you should expect out of CHEC in the future is we're going to be continuing to work on a trusted environment. We're going to be continuing our efforts in increasing capacity for public health and population health, and we're going to continue to be one of the hopefully trusted stakeholders and partners for organizations in the state. Thought I'd end up with, I didn't put my email up here either, but that's just because I was lazy and didn't want people calling me. One of the things, so first of all, you can learn more about IPHI programs by visiting the website there. And CHEC is not the only program at IPHI, and there's a lot of other cool health IT programs that are going on at IPHI that people may be interested in. But in particular, on our own website, Over the next few weeks, couple months, you're going to see, I think, a big transformation in what you see there. In the past, it's talked about programs that we're doing, grant opportunities, funding opportunities, et cetera, and you're going to start seeing some of the outcomes of the programs that we've had in place instead. And so there will be educational materials, there will be reports, there will be some of the artifacts that have been coming out of our activities that will go there. So I'd really encourage you to watch our activities there in the future. So now if I put on my other hat, I'm also supposed to talk about K-High, and I am a member of the board on K-High. And so I'm going to start off with the big things that I don't believe in again. But I think that one of the things that we really did and worked hard at is to define what K-High is all about. And I know that there are questions about the role of K-High, so I decided I'd go ahead and put up these incredibly long statements, and I'll let people read through them. If I think about K-High, and this is going to be a little self-serving, but I'm going to do it anyway. K-High is a collection of kind of the brain trust, the stakeholders that really have been living HIE in the state of California for some time, getting together and figuring out, so what is it that we need to do to continue to move the ball forward? And the goals of the organization are to create a California Trust framework, something that Chet got started, and K-High will continue to move forward. And the big target there is to ensure that providers can connect. And that's what we're trying to accomplish. If you look at the mission, there's a lot of information there about leveraging national initiatives, et cetera. But I think that there is one very important goal for K-High as we move forward, and that's to establish a lightweight, and that's important, self-governance function so that we can understand and accomplish exchange of information that cross boundary lines without a huge cost and a huge burden from a heavyweight infrastructure. People often compare what's going on in California to what's going on in New York and Texas, and in many ways they're the same. There are a lot of regional and enterprise HIOs in those states as well. What we're doing here in California is intentionally lightweight so that people can concentrate on moving information around and not paying for a heavyweight infrastructure to allow HIO to HIO exchange. Now, I'm not going to read through all of the primary goals of the organization as we move forward, but I think that there are some things up here that are really important. If you look at number 3, that's going to be one of our big goals to leverage documents that are already in front of us, such as the DRSA that was produced for exchange with federal agencies and large organizations through HealthyWay, and to leverage information already in place in the modular model participants agreements that were developed here in California to produce a document that helps organizations exchange information with each other without party-to-party, one-to-one agreements. And that's just something that we can't afford moving forward, and so that's part of the lightweight infrastructure that we see is very important. Although we're planning on building very strategically and carefully on the work that's already going forward with direct trust to support direct exchange and HealthyWay to support query-based exchange, we think it is important for K-High and California to enable other modes of exchange as well. And because we are California and not a national organization, we believe that we can move faster than some of the national organizations and blaze new trails a bit there in making sure that some of these other ways of doing exchange are incorporated in what we do. As an example, we still continue to lead in dealing with provider identity management through provider directories, and that'll be something that K-High continues to operate. I wanted to finish up then with just, so how do you learn more about K-High? Again, I've not put my email address up here, and if you look out on the website, you'll find Karen's, so I did that to her again. I'm sure that you will come find me in the parking lot afterwards. The materials that we do have are still hosted by Cal-OHI. I put up here that that's our temporary website because I do expect that K-High, as we continue to move forward, will stand up our own site. But importantly, if you want to participate in K-High, there is an application process. You can go up to the website, pull down the application, and go ahead and fill it in. It's not hard. And our meetings are all open meetings, and the meeting dates are posted on the Cal-OHI calendar. So I really encourage people to come, to listen to what we say, participate in what's going on, because this is part of how we're going to move things forward in California. Yeah.
So Aaron has been a tremendous asset to us here in California as well. He is my staff person who lives in Maryland. Yep, he does. He lives in Maryland, but you see him here a lot. And he is, as he transitions off of our team here in California, he is going to talk to you about the National Association of Trusted Exchange, not of Trusted Exchange. So for Trusted Exchange, you may know it as NATE. And it was previously the Western States Consortium. So we change names as we go along, and Aaron's going to tell you about NATE.
Thank you. Pam's shoes. Good afternoon, everyone. I was very self-serving when I sort of took a spot on the panel and put myself after Ollie and after Kehai, because a lot of what we're trying to do with NATE is much like a Russian doll, where Kehai is an example of bringing together many regional, sometimes sub-regional HIOs and finding ways to improve governance and to accelerate adoption. The states got together over the past 3 years and have tried to look at similar things. So a lot of us recognize, especially along the border, that being able to exchange with Oregon or Nevada should be equally as easy for me as it is to exchange between San Diego and Santa Cruz. San Diego and Santa Cruz actually corrected me one time when I said that, because they need to exchange with Hawaii, who's also a member of NATE. So very strategically, the benefits and the things that we were thinking about when we put up our organizations, and as people think about what are the benefits of joining, similar to Ollie, states go through a lot of things unique to states. Working with CMS is a very, very fun thing to do. And states hope that they can collaborate together and find ways to maximize the benefit to their programs by working together on multi-state IEPD activities, as well as really looking at very tough policy problems. So NATE's vision, of course, a scalable, sustainable trust and policy framework that supports and advances intrastate and interstate HIE, and it's the verb. We are very motivated in enabling the verb and working with each of the states to figure out what is the optimal way within their state to promote and advance both the verb and the appropriate nouns. So we're really looking at the policies that are applicable for interstate exchange and recognizing that those are dependent on how intrastate exchange occurs, working together with each of the states. Number of bullets here. Our membership is basically state entities or a delegate designee of that state entity. Some of our voting members are represented by the Director of Public Health, is an example from, I believe, Utah. We have members who, Cassie is actually the representative for the state of California. We also have SDEs representing states, where it's the state strategy to rely on the SDE for their go-forward activities with regards to governance. So in a word, NATE works on governance, but much like what we were talking about with the verb versus noun, it's a different type of governance than what most people think about, I believe. We're not here to tell you what you can and cannot do. We're here to try and help the states and those folks that work with us to find ways to get things done that they can do, and to make that what you can do together bigger across states, especially for interstate exchange. This last bullet is basically my job description. I have no real authority. I have a board that tells me what needs to be done, and they prioritize that for me, which is a big relief because I don't have to make some really, really hard decisions. Honestly, I'm always amazed by folks like the San Diego HIE and others that have to take on the entire problem at once. So I have a very easy job in that I only have so many resources, and I kind of get to say we can only focus on these things. So I want to advance that. So that just sort of segues to some ongoing projects and some of our current activities, just to give you guys sort of an idea of what the states have prioritized with our limited resources to work on going forward. We still operate a provider-to-provider for treatment purposes trust bundle. It's been in operation actually for over a year now. We went live on November 1, 2011 at the last the annual California Stakeholder Summit a year ago. So we've been in production with that. We have 3 of the HIOs that operate in California today being promoted to our interstate trust bundle. All of them completing an onboarding process that we've developed as states. We have I don't know how many total HISP that are onboarded, but HISP from Alaska, Oregon, California, Utah, Nevada's coming on, Hawaii's coming on, so on and so forth. So we've found ways to get to yes through these policies, and the HISPs that have come and asked us about it have looked at what we've done and agreed that that's sufficient, that they felt that that was sufficient for them to have trust, and that the governance process that we followed was something that they could comply with. One of the things that we did begin more than a year ago, almost 2 years ago, working on building that provider-to-provider for treatment purposes trust bundle was a federated provider directory. And it was just a concept of how do I help you discover who are my participants and who are their authorized end users. You know, being able to exchange outside of my HIO's parameters, being able to exchange with unaffiliated providers beyond the boundaries of who my HIO has signed so far. So we've been working continuously on that, on a national project that's being led by the IWG via an ONC grant. 4 of our states are part of that pilot. They have a total of 6 states participating. And the ideal endpoint would be, I need to discover who your doc was in the Bronx 2 years ago, because you've relocated to California, and that was the last time you were treated for what have you. So how do I query that entity? How do I send them a request? How do I get those records sent to me? And the Federated Provider Directory will offer us a platform to extend some policy questions that we might want to be able to discover about one another. Are you an accredited HISP? Are you a member of the NATE Trust Bundle, so on and so forth? Are you part of the Nationwide Health Information Exchange? I guess they don't call it the NIN anymore, though. Health E-Way. I missed that. It was NIN for me. The last thing that we're really working on, we're very excited about, ONC is very excited about, CMS is very excited about, is patient-mediated exchange, and really getting to the point where the behavior of patients might benefit, and we might be able to influence how people behave and get access to data so that they are able to really change their outcomes. And we broke that out into 2 different stages. We're very much about only building things that we're going to take live, and only building things that our partners believe are necessary. So the first step was just really coming up with a standard way that we believe will scale of getting data from providers to patients. And that's been done before on one-off kind of situations between MD Anderson and different PHRs and so forth. So we're looking at how do you do that with many HIOs involved and many PHRs involved, using trust bundles and a common framework for trust. We said that this is what we're going to do, and everyone was like, so what? We need the data to come back to us, and we need to be able to determine if that data has been changed since the last provider who sent it to them could do that. So really our stretch goal is to build this foundation and then to extend it and find out what is it that we have to build so that a provider can rely on data that comes from a PHR as if it was sent to him directly from the provider. So we're talking about provenance and immutability. So we're at the stage with this particular pilot looking at gaps and needs. And we're really benefiting from the KHI infrastructure and from our work with NATE and other organizations and being able to recruit the right types of facilities to help us make that happen. I don't really have much more to say. We do have a wonderful website. My sister-in-law did that, so I had to. My email address and my phone number.
So immediately after people say to me, so what are we going to do in California with HIE? Then they say, and so what are you going to do? Because they know that my title has HIE in it. And so I want to introduce you. Oh, and I have a staff, which the first deputy secretary did not have a staff. I have a staff, and I wear the second hat that I wear is the director of the California Office of Health Information Integrity within Health and Human Services. And so I have a very small, very dynamic, very hardworking staff. And if you have not met the next speaker, let me introduce you to Cassie McTaggart, who is my Chief of Health Information Policy and Standards in Cal Ojai. And she's going to talk to you a little bit about the future work that Cal Ojai is going to do, and then I will talk a little bit more about the work that we're going to do, and we'll have questions, and then we'll do our wrap-up, and we'll go out and make HIE happen across the rest of California. So, Cassie?
Thank you. There I am, right there. There's my name. So yes, this has just been an amazing 18 months that I've been with Cal Ojai. I know that the work that we've been doing with all of our wonderful stakeholders has gone on prior to me being here, but I can attest to the fact that the last 18 months has been fabulous. I've learned so much, and it's been wonderful. However, I'm not sure if many of you know, but Cal Ojai existed before we received the $38.8 million ARRA grant, and so we will continue to go back to what our prior responsibilities were, and I wanted to tell you a little bit about those if I can figure out how to progress. I can. Okay, wonderful. So what Cal Ojai will do moving forward is that we will continue to do the, we have a general fund budget that supports our statutorily outlined responsibilities that I have them kind of listed here, and it is to establish policy, provide direction, and monitor progress of HIPAA implementation for state departments. So that's what we did previously, and what we've done as we've also added staff and managed the ARRA grant and all of the work that we've done with all of our stakeholders. And so we'll continue to do that moving forward. Some other things we will do is we plan to take what we have learned from the private sector and the pilots that we've done and the demonstration projects that we've done, and take all of that information we can and help apply it to state departments to help facilitate the expansion of HIE within and amongst our own state departments. And that is in and of itself just very, very complicated. And then, of course, we will have to do it within whatever legislative authority that we have. So those are some things we'll also be working on. We'll also continue the privacy and security initiatives that we previously started, and also our community outreach. So I have some examples listed here. We'll continue to oversee and continue to move forward with the Cal Ojai policy steering team that we have many of the members here today. We had a meeting yesterday. They've been doing great work and really have a lot of subject matter experts that have helped to inform Cal Ojai in terms of policy changes that we need to do going forward. And then we also will continue to participate in the organizations that both Rim and Aaron talked about. We'll continue to participate in KHI and to see what we can do to help move that forward, and then also continue our participation in NATE to continue working on interstate exchange. And then lastly, we'll continue. We've really had a goal of education, trying to either pull from educational resources about HIE and privacy and security that already exist, or to develop some of them on our own. I know that many of you have provided input to, we had developed an authorization tool, and we have a new draft posted on our website, but we have a lot of tools on our website that we want to continue to update, and as we develop tools or we find tools that are already out there, we post them to our website. So if anyone has any tools that we should include on our website that already exist, we would love to find out about them and get them posted there. So I think, for the most part, that's what we'll be doing. As Pam mentioned, it's a small but mighty staff. There aren't very many of us after the ARRA grant goes away, but we are happy to help out in any way we can and to continue to be involved in all of the efforts that are going on. And I can't wait to see what happens over the course of the next 4 to 20 years. So, oh, whoops, I messed that up. Uh-oh. Okay, well, I had my contact information up there. Apparently, I don't really want you to contact me, so just kidding. There we go. Okay, so we have our Cal Ojai website, which has the resources that we previously talked about. Also, we have an email address that you can actually contact if you have any questions or you want to get on we have an email blast list that we have Pam sends out fabulous emails updating on things that we have going on. And then also there is my email and phone number. I like to chat, as you can see, so I'm happy to talk to anyone and help out any way that we can. So I think I covered it all, Pam. Wonderful, thank you.
So one of the things that I think is really important for many of you in the room to understand, some of you are living what I'm about to talk about, and that is the fact that while we have been able to use the ARRA grant money to help our partners external to state government get to yes as far as sharing information. We did not, unlike many states, we did not take much of that money at all to work internally on state government projects. And so we're going to be focusing on information exchange within government. And that's how we will bring the work and the lessons that we've learned about HIE from all of you back into government. And many of you are new faces and new names in the room because you're county partners with us. And we don't have a culture necessarily in California at this point in time where the answer, when the question is, can we share information, the answer isn't intrinsically, why, sure, yes, of course we can share information, even if it's between government partners. And as we look at some of our more complex information needs within government, like our foster children and care management across the care continuum for foster children, there's a lot of information that's being siloed within government, that's creating duplicative IT systems, duplicative information fields, and confusion and expense. And I'm going to be working with my staff under the umbrella of HIPAA, and that being portability and movement of information, working on getting government partners to yes. So we will still be working on health information exchange. It won't be as visible, perhaps, to many of you as it has been, but we are not going away. Our job is huge. In fact, I was recently tasked by the Secretary to develop a data strategy plan for agency departments, because we do not have an agency-wide data strategy plan. That's huge. And that's people talking about their data needs, what they have, as well as what they would like to have, that's siloed in separate systems within government. We did a survey, we did an initial inventory of a data use case around foster children, and we found just within Health and Human Services Agency, we had over 200 separate systems that contained information about foster children. And when we looked at the data field inventory, there was a lot of duplication. So that's what I, as the Deputy Secretary HIE, am going to be working on, but we're also going to be focusing back on our HIPAA. Now that brings to mind, for many of you, questions that the Cal Ojai staff have been working on for years. Privacy law and the need for exemptions, or I'm drawing a total blank on the word. I'm tired at the end of the day. About when there's a breach or when there's a request for information, preemption. That's the word I was looking for. A preemption analysis. Again, getting to yes, because we know if we're going to care for the patient, if we're going to implement and operate under the triple aim in California, we have to not be using privacy law inappropriately. And we know that in an environment, as soon as there's a question about privacy and someone, for whatever reason, either that it's fear about liability, or they don't have time, or they don't have interest, they'll say, I can't do that because of HIPAA. And that's not appropriate. So there's great opportunities for education, and there's great opportunities for policy clarification, and we're going to be working on that. For instance, did you know that in California, one of the reasons why your patients have to sign paper is because California law doesn't accept an e-signature. Well, there's a great opportunity to make a better, efficient world in health information exchange. So that's just one example of where we have to bring our law into line with this new environment that we're living in. So we've learned a lot, and we've learned from you. So at that point, I will shut up, believe it or not, and ask if there are any questions of any of our panelists at this point. I can't see because of the light, so.
I was just wondering what the plan is for integrating the unincorporated areas that still were not connected yet.
So her question is, what's the plan for what we have referred to, some people don't like the term, but we use the term white spaces. Is that the question you're asking? Yeah. Going forward, K-High is going to take the lead on that. Am I misspeaking? Yeah, no. Yeah, no? Yeah, yeah. Well, because, okay, so Rim's going to do it. Rim's going to write a policy about that, and then he's going to teach a class on it.
So,
Give us your number.
Yeah, exactly. She says, give us your number.
I can just holler, right?
1-800-RIM should get you all the answers that you need to get.
Okay, keep my-
Can you tell we all really like each other? Can you tell that?
All right, so is this working now?
I don't know.
I'm just going to yell. I think that, as we've, one of the big programs that Czech has been concentrating on in the latter half of this year, and I didn't do that, is reach out to the rural areas of California, and there's been a large incentive program. Raina talked about that in the last discussion. And one of the things that we're continuing to do as we move forward through the end of this year is we're making a lot of direct accounts available for those areas that aren't covered by HIOs. So those are kind of the last steps in what Czech can do under the ARRA funding. We see that one of the big goals for K-High and moving forward is to make sure that everybody can be reached. So I do believe it's going to be one of the things that K-High is going to be looking at moving forward as well.
And I'd like to build on that because there's different types of white space. We have a lot of white space geographically, I think is how people typically think about it. But we also have white space in exchanging with our federal partners.
Yeah.
For example, via the VA or the DOD, San Diego, a lot of the naval facilities, very important. That's important to almost everyone in the room.
So we are actually very much at NATE focused on figuring out how do we address that white space. Some of those things are specifically related to the difference between state and federal policy. Some of it is just we need to get those folks in the room, just like we had to get each one of our constituents in a room. And for federal agencies, it's easier to get a board like NATE together and collaborate with us and then have us work with all of the states to distribute that solution to a white space where a vet who can get his data at My Health
Or her.
eVet, or her, and forward it to, Pam is actually a vet of the Navy. But that's it. The patient's got the data. There's no easy way for them to forward it to their do their own care coordination, for example. So that's one of the projects that we're working on. SSA would love to be able to discover all the folks that have direct addresses through the Federated Provider Directory on a multi-state basis. We might be able to help them find those folks. Finally, with regards to enabling trust amongst entities, working together, we can identify the policies that we have to have in place according to applicable law and facilitate. What NATE facilitates is the variance of those laws as appropriate. None of us, all of our contracts, and I've read like every contract in the state of California in the last 3 years, says that they will comply with state law. So we want to work with the state of California, the state of Oregon, all of the states to help facilitate folks working in compliance with their law without having to discover and be able to comply with laws that we can't enforce on the state of Oregon, for example.
So I think the main thing for you to know is that if you don't know who else to contact, you can contact me. And most of you are here, I think, because you're on our constant contact list. But I don't have a slide. But you can reach me a couple of different ways through our website. There's a contact, just sort of a generic email in there. But for those of you who don't have my personal email, it's plane, Plane. I try to stay off of planes as much as possible. They exhaust me now. But it's plane at chhs.ca.gov. And if I am not the person to help you, or if my staff are not working on something that's going to be directly applicable to you, I will try to put you in touch with the correct folks. It's a very confusing landscape because it is an industry in its infancy. The verbiage changes, the names of organizations change, the people change. We've watched over the 4 years. It's for the most part, it's a lot of the same people doing it, but they've moved around. They're in different jobs. They may be working for different organizations, but they're still in the landscape, and we still know how to get in touch with them. And again, I think the most important thing that we can leverage our website, our Cal Ojai website for, is a place to put tools for you and things that are meaningful to you. The last thing in the world we need to do in this very complicated new industry is try to complicate it even more than it already is. In fact, I think it's simple is better, and we're working on simple, and I think getting to yes can be a lot more simple than it has been. That's my personal philosophy, and that's what my staff and I will be working on going forward. So let's see if there are other questions. There's somebody's pointing over there, but I don't know where they're pointing to. Oh, Lisa. Hi, Richard.
One of the opportunities that we see going forward as we at Blue Shield of California Foundation continue to work on safety net integration around the state is this whole issue that was mentioned this morning of better behavioral health and primary care integration. So as I hear you talk about your future work at the intersection of HIE and HIPAA, boy, it sounds like continuing to lead the efforts to allow for more of that integration of behavioral health data into these data streams would be perhaps a natural area for you all to be working on. So wondering, is that the case?
Well, it certainly is the case. And the question that it goes back to ACA, that's requiring different ways of paying for more consolidated information. And so we're going to be working very closely with the payers. Most specifically, Dr. Scott and I talk. If you want to listen in on one of our conversations, you have to be up really early because we talk about 2 or 3 mornings a week between 6:30 and 7:30 as we're both commuting into work, because it's the only time we really get to talk to each other, but coordinating the activities around updating the MITA, the Medicaid Information Technology Architecture System, and the requirement that is within that upgrading to incorporate and include more health information exchange capability within that framework, and all the other work that we're doing. Now, obviously, there's a huge overlap both for behavioral health as well as some of the other protected areas that are going to be covered, and clients are covered by Medi-Cal, and we know that's going to explode. Probably, it's going to explode. We're going to have more patients being covered by Medi-Cal, and that's going to require more consolidation of information to make sure that we're using our tax dollars in the very best way we can. So, absolutely, I think what we've learned, we as a country have learned over the last 4 years, is you can't separate physical medicine from behavioral health medicine and expect to have as good an outcome as you could have if you looked at the total patient care need. ONC has also told us that they're going to be wanting to work with us going forward on some projects like ADT alerts. I said to our project manager at ONC, what are you going to do after the ARRA funding ends? And he said, I've already been assigned to a project that has to do with ADT alerts. Not specific. He didn't say that his work was specifically going to be around behavioral health, but I do know that they're going to be specifically looking at admission, discharge, transfer alerts relative to behavioral health and tying that back to primary care provision And so I think there's going to be a lot of opportunity for California to continue to be represented on the national stage, and there may or may not be some additional funding that comes down. It won't be to the tune probably of the $38 million that we've had, but you know what? We've done a pretty darn good job of stretching $38 million to cover a state the size of California, and I think you all should be incredibly proud of the work that you've done. Other questions? I hope I answered that question, Richard. I went blah, 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 blah. I hope there was something in there that answered your question. No, we've answered all your questions. Well, Rim's got a question.
No, I don't have, well, my first question is, could I make the microphone work this time? It has to say something that the policy guy could figure it out and the technology guy couldn't, so. I'm trying not to think about that. It just, the last question reminded me of something that I think that we ought to go ahead and recognize is I'm very happy to be sitting up here and be potentially one of the people that you call next year, but I think that an important answer to that question is also a bunch of people that are in the audience, and it just brought it to mind to start talking about behavioral health. One of the things that's happened over the course of the last year is that I have seen the maturity of health information exchange in the state go from scratching around to make sure that we could get a lab result delivered to really looking at higher value in the information that moves. And so what reminded me of that is our colleagues down in Orange County that are specifically looking at how do I integrate behavioral health information in an operating HIO so that I can move data around that needs to move and not just continue to ignore behavioral health information. We have our colleagues at Inland Empire that are starting to look at data analytics as opposed to just getting you clinical information. Can I get you more value about the clinical information and start taking a look at population health and other things that are helping physicians do their job? We have the folks, our colleagues down in LA at LA Care, that are looking at getting their clients more involved by through a Blue Button initiative where they're getting information into patients' hands as opposed to just concentrating on providers. So the answer to who you're going to call to a large extent is your neighbors out here in the audience too, because we're seeing a lot of expansion, a lot of success about people that we've all been working with.
Great.